So thank you again, Dr. McDonald, for doing this. I wanted to just kind of get right into it. Is it going to be safe to send kids back to school this fall?
Yes, it's going to be safe to send kids back to school this fall. I think the universal mask mandate makes it safe. And I think that's just a key thing. One of the things you're seeing in Rhode Island is we're requiring masks in schools through K through 12. Other states haven't done that, and it's not going as well for them. And I think that's just an important thing is this is an important public health intervention, and it's something that we need to do. And quite frankly, we've done it before. We did it last year. It worked out well. I think one of the things people forget about 2020, as bad as it was, we didn't see flu. We didn't see RSV. We didn't see a lot of kids getting sick from school when they were in school. And I think it's just important to say that these darn little things do work. And so I think that's going to be a lot of what helps 2021. It's going to be a good school year. We're going to be okay.
There's also, in addition to masks, now we have vaccines this school year for at least those who are 12 and up. As far as how much of the student population is vaccinated in Rhode Island, does the Department of Health have an idea of how many students are fully vaccinated heading into the school year?
Yeah, not as many as we'd like. We'd actually like all the kids to be vaccinated. And it varies a lot by school districts. One of the things we've seen is some school districts have 90% of kids vaccinated, which is great. But some of our higher density communities like Providence, Pawtucket, much lower vaccination rates. And I think it's just something we're concerned about. And I think it really gets to that issue is like, if you're 12 and older, it's still a good idea to get your vaccine. And I think one of the things that kids need to ask themselves, and I think one of the things we have to admit is that I was a kid too. And when I was 12, 13, 14, I wasn't thinking about anything that had to do with anybody other else than myself. And that's okay. But the reality of it is when you're a kid, you're getting a vaccine to protect yourself, but more so to protect the others around you and your family and the people outside our family that are people we don't even know. And I think that's a different concept for people. I think more and more in our country, we've gotten a little bit away from the concept of protecting our neighbor that we don't know. Mm-hmm. And I think that just gets to a larger issue is that if we're going to survive the virus as a country, we need to be really thinking about the people we don't know. How do we protect the people we don't know? And the best way to do that is get a vaccine and get it soon if you haven't gotten it already.
Now, Pfizer's vaccine got fully approved by the FDA this week. Moderna just submitted initiated the rolling submission process for its full approval. Talk to me about, why should this encourage parents to get themselves and their children vaccinated if they haven't already? And I know that this only applies to 16 plus for that full approval. But Pfizer, is the vaccine that's being supplied to kids 12 and up right now. So why should this encourage?
Yeah, so let's keep this in mind. 61% of the students 15 to 18 are at least partially vaccinated. That's great. But when the Food and Drug Administration actually approves a drug, it's gone through a very rigorous process. That should provide a great deal of assurance. Now, if you were nervous before, you don't need to be nervous anymore. It's this assurance is substantial. And I think the FDA approving it, the Pfizer vaccine for 16 and older, is a big thing. And I think it's something people should take advantage of. And I think right now it's like, if you had any qualms, I think now they should be quieted down and go to it. Because keep in mind, all the other vaccines we give our kids are FDA approved. We've all been doing this. And the vaccines we give of COVID are some of the most well-researched vaccines in the world, some of the most well-monitored vaccines in the world, and really during a time when it matters the most. So I think really right now it's like, I think the FDA approval matters a lot. And I think if you're a part of that group that isn't part of that 61% of kids who hasn't started their vaccine, really encourage you to ask yourself why. What is my barrier? What am I doing? Why haven't I gotten it? And a lot of times for kids, it's just that I haven't thought about it. I just haven't gotten ready for it. Mm-hmm. Or I don't think it's important. And I'm just encouraging you, let's go forward and go get that done.
Now, there are a subset of the population, 12 and under, who there is no vaccine authorized for yet, or at least under emergency use. When do we expect that to come through by the FDA? Do we think mid-school year or towards the end of the fall? And by mid-school year, I mean mid-semester.
I'm hoping it's before the end of 2021. And I think in what I see the Food and Drug Administration was looking for is more data, and good for them. Like, I want my FDA to be thorough before they grant an emergency use authorization. So good for them to want more data. And that's great. but I don't think we're going to see it right now. I think it's going to be towards the end of the fall or maybe early winter. We have to wait and see, but I think we'll see it before the end of 2021. And I know a lot of parents have asked about it. Some of the folks I've talked to have 10, 11-year-olds, other children who are high risk, and they're very worried about other kids not getting vaccinated. And that's why I think the mask mandate does help mitigate a fair amount of that fear in the short term, which I think that's part of why the mask mandate was just so important.
So Rhode Island has this mask mandate largely because of the Delta strain. Otherwise, we were going to have schools in person without masks for fully vaccinated students, but that has changed things. So how much of a risk does the Delta strain pose to children? I know it's been affecting younger adults more, putting them in hospitals. How is it affecting children, and are we seeing those impacts in Rhode Island children, especially in hospitals?
Yeah, so what I would just say about Delta is keep in mind, Delta is much more contagious. There's just a lot more Delta virus. When people have an infection, their viral load is much higher. And so it's just more contagious, so it spreads there. We're not seeing a lot more kids that have been in the hospital though, but if you get a lot more kids infected, then a small percentage of a big number becomes a big number. And this is why it's important for everybody wearing masks when they're in school. And you're right, Delta changed the world. It literally changed the world. It definitely changed Rhode Island. And it was bad enough we had this darn pandemic in the first place, but Delta just made it a whole bunch harder. And keep in mind, I want to show you this, Alexandra. I did this before, but I'll show it again. This is 1,000 jelly beans, my friend. That's 1,000 jelly beans. It's 1,000 times the viral load compared to the original COVID. So when people have symptoms, they're just more likely to have a lot more virus on them. So they're more likely to spread it. And so the point is, this is why a mask mandate was all the more important. If we had people wearing masks, staying 3 feet apart, getting as many people vaccinated as possible, making sure our ventilation is good, we're going to be in good shape, Rhode Island.
So I know that another thing parents might be concerned about, students might be concerned about, is mask breaks, especially if, you're heading into the classroom and it's still as hot as it is today, for example. What is the Department of Health stance on mask breaks for kids?
That's going to be up to schools to figure out what that looks like. I think this is a good example of like open windows in schools if you can, because I think it just cools off the building. And, it is hot, and I think this is one of the things where comfort's important, but keep in mind, we did this last year. We're not asking people to do something we weren't already successful at. We know we can do this, and we know we've done it. And I think it's one of those things where we have to remember, this is a season of inconvenience. The pandemic is going to end someday. It's just not today that it's going to end. So we're just asking to go through a season right now. I'm highly optimistic that 2022 is going to be a whole different world in a much better way. That's my hope and prayer, that 2022 is much better.
What would your advice be to a 5-year-old or a 6-year-old starting kindergarten this year?
So if you're a 5-year-old going to kindergarten, one, have fun every day. That's really important. Be nice to other people and make friends. Wear your mask, and that's one way that we can show we're being a good friend. The fourth thing I tell you that's really important for school is you just got to pay attention to what's going on in front of you. Because if you pay attention to what's going on in front of you, you learn more. If you learn more, you can be a doctor like me someday, and you can be on TV.
I want to shift gears a little bit, and you kind of touched on this earlier. So in terms of, other viruses like RSV, flu, common cold, whatever it is that still circulate every year, flu was largely not around last year, neither was RSV, but I feel like we have been seeing more of an increase in general viral activity over the summer. What do you foresee happening in schools this year? And keep in mind that there will be masks again. So do you think that we'll have those kind of viruses still circulating, or similar to last fall?
We have seen more viruses circulating because people are moving about. We actually issued a provider advisory yesterday to the physician community about the increase in RSV, that now was time to start Synagis to prevent RSV infections in high-risk little babies. So we are going to see more of this, but if we all wear our masks, it's going to protect us from spreading disease in school, and masks are effective, but, we are seeing more RSV. We're seeing a little bit more croup as well, and other viruses that cause common colds. And this is expected. It's really one of those things that happens with people moving it there and about. I'm not super worried about RSV or respiratory syncytial virus in children, because in children just gives you an annoying cold.
Mhm.
In adults, RSV gives you a nasty cold. RSV is a problem for the elderly, though. It does claim the lives of people who are elderly.
Mm.
And those are folks who don't really have a good way of preventing it, except wearing a mask as well. And these are just things that people need to consider. How are they going to go about life? You know, what am I doing to protect myself right now? But keep in mind, the amount of RSV we're seeing now is similar to what we see in typical years. It's not unexpected. It's normal, you know, so it just came a little earlier this year.
Okay. How are Rhode Island children doing in terms of routine vaccinations right now? I know that that was a problem in the earlier days of the pandemic where routine care was being put off. Parents didn't want to go into hospitals with their kids. So what are we seeing as we head into the 2021 school year?
Yeah, we did see some problems when it came to routine vaccinations for children. That's largely improving, you know, and we're seeing that return more to normal. When I talk to my friends who are pediatricians, they're telling me they're doing a lot of physicals in their offices. Kids are coming back for their routine shots, and that's important. So we're getting close to normal, but we still have some areas to catch up. And I think one of the messages to a parent is if you've fallen behind on routine vaccinations, your pediatrician still likes you a lot. They'd welcome you back. No one's going to judge you. Just call them, go ahead and get caught up on your shots, and they're happy to do that for you. And I know the pediatricians are working very hard all across the state this summer, many without a break, just to make sure kids are caught up with shots, because pediatricians know the power of prevention. You know, that old expression is so true. An ounce of prevention's worth a pound of cure, and pediatricians love preventing illness.
Anything else that local parents should know when they are sending their kids off to school?
You know, our kids often learn more from us by what we say and what we do. More is caught than taught. You know, if we're complaining about mask wearing and we're complaining about life in general, our kids see that. I think if we say to our kids, look, this is what we're doing this year just for this season because we have to get through the pandemic, and this is our way of protecting others, I think that's a positive. I teach my children to care about other people. If there's one thing I wish we would all do in Rhode Island and really the United States is teach our children how powerful and important it is to care so much about other people. Now more than ever, we desperately need each other, and wearing a mask is one way you can show you care deeply about other people.
And then as we close out, we are hoping that this surge of cases from Delta eventually plummets down as we've seen happen in other countries around the world. Why do you think we are seeing this increase in cases across the country? I believe I know the answer, but why do you think it's
Yeah.
happening? And then when do you think it'll trickle down and plummet?
So the reason we're seeing an increase in cases is we still have a lot of people in our country who are susceptible to the virus. One of the important lessons that we talked about from the beginning of the pandemic is this became a pandemic because no one had immunity. Everybody was susceptible across the whole planet. So right now, the people who really have protection are those who've been vaccinated or had an immune response to the disease. You're seeing it in Rhode Island and really to much greater extent across the United States because there's still a lot of people who are susceptible. If 90 million people haven't had the vaccine yet, that's a good chunk of our country that's still at risk. And I think it's important just to have that perspective is there's still a lot of people at risk. And that's why this pandemic hasn't ended yet. You know, and I want to make this final point with you, Alexandra. It's always been team human versus team virus. It's not team vaccinated against team unvaccinated.
Mm.
If you find friends who are unvaccinated, we want to encourage, support, and listen. But we don't want to judge or get anybody angry. That's never helpful. What is important is just to respect people where they are and just encourage them in the right direction. And hopefully with a gentle phrase or two, we can persuade people to move in that direction.
Thank you so much, Dr. McDonald. Always helpful hearing from you.